Good morning, everyone. Welcome back into North Dakota today. Altru is hosting a free screening event for breast cancer awareness, and they are partnering with Women's Way to provide informational resources and free mammograms for those who qualify. Nurse practitioner Jackie Roberts is here with more. Welcome, Jackie.
Thank you. Thank you for having me.
Yes, of course. Well, we're going into October, which is Breast Cancer Awareness Month, so this event is really so important.
Yes, it is. It's really important that we get information out there about screening and breast cancer. You know, 1 in 8 women will have breast cancer, so it's very common. So, yeah.
Absolutely. So what are maybe some warning signs or symptoms of someone developing breast cancer?
Yeah, so that's a great question. A lot of people think that they need or have to develop signs or symptoms of something when a disease is present, but with breast cancer, sometimes there is no signs or symptoms right away. So in order to find it early, we really need to do screenings, mammograms, self-breast exams, just be aware of breast cancer. If you do have symptoms, it could be something like pain in the breast, maybe some nipple discharge, some change in color of the breast, distortion, maybe the breast is changed in size or shape. So just being very aware of breast health.
So we're talking about this event, which is screenings. Who would you recommend to get screened?
Yeah, so there's different guidelines for screening. I think each woman should talk to their primary care provider about what their risks are, what their risk factors are, and if they have a family history, that would be important. So, but a lot of screening guidelines will start women with annual mammograms at age 40 to 74. Some recommend age 50 to 74, so it just depends on which guideline, but that discussion is really important to have with your primary care provider.
Absolutely. Would you say, though, that it's maybe never too early to start looking out for these warning signs and maybe even getting screened?
Yes, so always doing self-breast exams or talking to your primary provider at your annual physical, having them do a breast exam, and then just teaching about what kind of risk factors or what things they may have in their life, family history or personal history, and just that self-awareness.
Definitely. So you've mentioned this self-exam a couple of times. Do you want to fill our viewers in, maybe if they're unfamiliar about what that is?
Sure. So a lot of times we'll recommend that women just be familiar with their breast tissue. So sometimes we ask that once a month during the shower or before bedtime that they're doing some type of breast exam. I always say that if they are able to feel their breast, they know if there's a change or something different, and then they can come in and have that evaluated. Some women aren't comfortable doing breast exams. They get worried or they get stressed out about that, and then just going into your primary provider and having them do it at your annual is fine too.
Absolutely. So circling back to this event, when is it and who can attend?
Yeah, so it will be Wednesday, October 18th from 5 till 8 at Altru Cancer Center in Grand Forks. It's open to any woman who wants more information about breast cancer screenings. We'll be doing breast exams and teaching patients how to do exams on themselves. We'll be talking to them about mammograms and screenings and what that involves. And then on the hour, another nurse practitioner, Ann Nygaard, and myself will talk a little bit about genetics and how that relates to breast cancer, and if women should be on higher alert for that because of what might be in their family.
So who would you really recommend to attend this event?
I think any woman over the age of 18 who wants to learn more about breast cancer screening and breast health.
Wonderful.
So, yeah, it's open to anyone.
Yeah. And then do people have to sign up, or can they just kind of show up?
They can call because we will set appointments for them to have breast screenings done with a provider, so nurse practitioner or physician, and we'll set up times for them. So yeah, and they can call the 701-780-5400 is our main number, and we'll get them an appointment for that evening.
Wonderful. Well, I know that you have been in your role for a long time now. How does this really feel to be able to provide this service to the community and educate people as well?
Yeah. So I've been at Altru Cancer Center for 23 years, and I have a strong passion for women's health, breast cancer, and then genetics as it relates to breast cancer. I also have a strong interest in rural health and access. So if women in the rural setting are able to get to their mammograms. So it feels good to give back to the community, and I've done a lot of outreach in some of our smaller communities and attend some of their events in October. And it just gives you a good feeling when you leave and drive home, and people are so appreciative for all the information.
Yes. Well, this is truly so important, especially marking Breast Cancer Awareness Month. So thank you so much for sharing that with us.
Yeah, thank you for having me.
Yes, of course. All right, everyone, stick around. Coming up on today's show, Essentia Health has information about the importance of getting your cholesterol levels checked. That's up next.